Joining us now on the program for our weekly mental health conversation is Carrie Krawiec from the Birmingham Maple Clinic. Carrie, thank you as always for joining us.
Good morning. Thank you for having me.
Yeah, glad to have you on to talk about week. Monday, February 27th marks the beginning of Eating Disorders Awareness Week, a campaign to educate the public about the realities of eating disorders and how they manifest, how they are treated, and ultimately how the recovery from them goes for these individuals. And it happens to people all across the board in all different walks of life. But there's still, even today, as we put more of a focus on mental health and the stigma across the board for mental health has kind of been diminished to some extent. That hasn't exactly been the same for eating disorders. So how does it factor in to people coming forward and ultimately treating those eating disorders when that stigma is still kind of there and that denial is really well set in place in some cases?
Absolutely. I mean, eating disorders, it's important this week to give them attention. And even a simple Google search will first take you to anorexia, which is the most well known of eating disorders, but not the most common. So, when most people think of eating disorders, they think of those very severely thin people and they think of the very severe restrictions. But what isn't necessarily considered is that how many people are actually suffering from other forms of disordered eating. And it's really an opportunity to bring attention to all the ways in which our healthy eating behaviors impact our health and our family. Eating disorders are among the most lethal of mental health conditions.
And as we mentioned, these are disorders that affect people across a variety of different backgrounds and different demographics, but it's typically kind of it's stereotypically seen as more of a quote unquote women's issue, but it affects more than just women. It affects men, it affects women of various ages, men of different ages. So just how much of a broad scope of people do eating disorders tend to affect?
Absolutely. Every race, age, culture, ethnicity is affected by eating disorders. And actually, interestingly, westernization of people who've come and immigrated from other countries and then come here are a population that's at increasing risk for a variety of reasons. So among all eating disorders, often things start out perhaps sort of innocently, maybe an attempt at health or dieting, maybe as a response to stress or change. And then what happens is that they evolve and kind of avalanche over time into more and more problematic behavior. But we are seeing them across every population. What's interesting with the science is that there are some common factors. So even though a person's habits may be different than one other or another, but yet they might still be diagnosed with the same eating disorder, what we're noticing is some common themes. So some social themes like bullying or some family history of idealization of certain body weights or types, family history and biological contributors, such as like a first degree relative having an eating disorder themselves, or that would be like a sibling or a parent. And also, a first degree relative having another mental health condition like anxiety or depression, those might also play a role. So we're seeing like biologic factors across all eating disorders. We're seeing social factors, psychological factors such as perfectionism and anxiety and rigidity, excuse me, that also play a role. So even though eating disorders look different amongst people, and it is not always that extremely thin way it manifests, but we are seeing some common themes across all people with eating disorders.
We're joined on the program today by Carrie Krawiec, a therapist at the Birmingham Maple Clinic. You can find more information on the website at birminghammaple.com. Birminghammaple.com to get in contact with Carrie and the professionals there at the Birmingham Maple Clinic. And in terms of how a treatment would manifest itself. Typically, how are those patients that are afflicted with an eating disorder ultimately getting into contact with professionals like yourself or others at the Birmingham Maple Clinic or other mental health facilities or practices?
Sure. I mean, in some ways, unfortunately, still takes a lot of time because initially it can be concealed, right? Someone may say, "Oh, I've become a vegan," but if you're only eating romaine lettuce, that's not really healthy veganism. That's something else. But it can sort of go on for a long while before people say, "Wow, this really has arrived at a time where I'm concerned for you," or a person is, say, for example, concerned for themselves. And so it can take time, but the most appropriate treatment is a combination. It includes both nutritional counseling and the development of healthy eating behaviors and habits, medical counseling and supervision of a doctor to make sure, because a lot of body functions are involved. And then also talk therapy, group therapy, or family therapy to address some of the underlying causes.
And these are issues that are multifactorial. They often require treatment from not just mental health professionals, but those in other medical professions as well. We recently talked to another professional that about eating disorders a few months ago that was able to explain this to us. But from your perspective as a mental health professional, how are you consulting with other doctors that a patient may be seeing in order to conduct a treatment on the mental health side for an eating disorder that is right for one patient versus another, given that these circumstances, these individuals are so varying across the board when it comes to eating disorders?
Sure. When that information is more well known, it's absolutely imperative that therapists and professionals that are trained specifically in eating disorders, they recognize the signs and symptoms, and therapists, psychologists, and other mental health professionals that work in the eating disorder community are usually well connected to those other professionals. There's a network of nutritionists, dietitians, and doctors who are all really on the same page and can provide systematic care, whether that's outpatient or inpatient, or what's called day treatment. So like a program where you go, from say 9 to 3 or 9 to 5, and then return to your home for the evening. But it really is the best treated, in a with a whole network.
We're joined by Carrie Krawiec on today's edition of the Megacast, a therapist at the Birmingham Maple Clinic. You can find them online on birminghammaple.com. And beyond the treatment, there's also factors outside of treatment that also contribute to the success of the recovery. Certainly, relationships with family and friends, and being able to monitor and manage some of those triggers that may lead to exacerbating your eating disorder on a personal level. So, how much of an impact can those friends and those families and the ways that they behave towards someone that may have an eating disorder ultimately impact the way that they recover, but also the way that they're triggered and ultimately leading into some of these eating disorders?
Sure, I think, like it could be very helpful to have family therapy, or to even have other family members in individual therapy to understand their own thoughts, guilt, feelings, things associated with body weight, dieting, body shape, cultural things, trauma. Definitely understanding, even like I said, anxiety and depression, the way in which your moods and emotions may impact another member of your household can be very informative and help prevent, like you said, the cycles, or even codependency and enabling that might happen in families when one person is responding to the moods and emotions of somebody else.
More information and ways to get in contact with the Birmingham Maple Clinic can be found on their website, birminghammaple.com. You can also call them at 248 646 6659. And in terms of that treatment, how typically, or what typically would be experienced between a therapist or another mental health professional and someone with an eating disorder to bring that treatment along and begin that recovery process that's often quite complicated?
So like most things, any medical condition or mental health condition, the intensity and of the symptoms, the severity of the symptoms at the time are going to help to guide the severity of the treatment. That for some, starting treatment initially, might mean that outpatient is sufficient. For other people, where the behaviors are very deeply ingrained, and the symptoms are very severe or even medically emergent, the treatment would be more intensive. And so that would be guided by, the information you're getting at the time. Certainly an exploration of the history of the behaviors, the history of trauma, the history of the family, the history of other mental health conditions, the history of other treatment episodes would all guide sort of what intervention takes place immediately after assessment.
And eating disorders, they're extremely dangerous. They're deadly. They can have a number of different health effects beyond the mental health effects on an individual, and especially on children, because they're going through their development both physically their bodies, but also their brains too. So these can have immense impacts on kids. So what's your parents be doing to check in with their child, or to at least be able to maybe clock that their child may be in the pre-stages of an eating disorder or at risk to develop one?
Sure. I mean, as parents, modifying the way in which you talk about your own body and the way you talk about your child's body or other people's bodies in general is going to be one way. Offering corrections or helpful reminders if someone is talking about their body in a critiquing way or fantasizing about their body looking in some way different, because certainly having a disordered body image and a disordered body ideal are two of those common factors. Certainly in a household, limiting any bullying between siblings and being aware of bullying, especially bullying about a person's body that's happening outside of the home, and making interventions, with the school as needed, or certainly helping to coach your own child how to cope with those feelings would help. Again, especially since most of them start in adolescence, just being, aware, supervising what, you're not with your child perhaps for every meal they eat. But again, if you notice some change in behaviors and someone's all of a sudden switched to, I am only eating organic, but then it becomes more and more restrictive, or I'm intermittent fasting, but then the time of eating never arrives. We have all these sort of code words now, like I said, it's vegan or keto or whatever, and they're sort of under the guise of health. But what happens is when someone uses those words to conceal some behaviors becoming more and more and more restrictive. So just kind of trying to clock that and gain some understanding with curiosity and compassion. Okay, like I know you've taken this vegan approach, and how are you going to do it in the most healthy way possible?
And in terms of monitoring these symptoms and these behaviors, both for parents as well as for individuals themselves or their friends, their family, their colleagues, when is it time, or when should there be that conversation about seeking mental health assistance in treating an eating disorder, or going and getting formally diagnosed by another medical professional as well?
Sure. I think like one rule of thumb is always when a person's behavior matches what they say they want. So if you're talking to your friend or family and they're saying, I want to be healthy, but their behavior is not in line with health, then certainly reflecting that back to them. There's disparity there. There's incongruence there. This thing that you're saying does not match with the thing that you're doing. And then that would be certainly an impetus for change.
More information and ways to get in contact with the Birmingham Maple Clinic can be found on birminghammaple.com. You can also send them an email, info@birminghammaple.com, or call them 248-646-6659, 248-646-6659 for more information. Carrie, as we are approaching the beginning of Eating Disorders Awareness Week, and we've had an extensive conversation about eating disorders. Anything else that we haven't discussed yet today that would be important for our audience to be considering about eating disorders, about treatment, about looking for symptoms, or anything else that we have not discussed yet?
Sure. Again, like I said, what often gets the most attention, the restrictive eating gets the most attention, and perhaps there's some sensitivity in confronting someone about binge eating or overeating and those behaviors. But certainly that's an area where more Americans are facing disordered eating and the psychological and physical health. Another thing that I think is interesting that's only getting just a little bit of attention is the abuse of diabetes related drugs and or the misuse of insulin, that people are using those things to affect their body weight. And this is something that's fairly new and only now just getting research, and isn't even fully understood yet as how it relates to the eating disorder community. So something to come on this topic in the future.
You can get in contact with Carrie and the other professionals at the Birmingham Maple Clinic on their website, birminghammaple.com, or 248-646-6659. Carrie, thank you as always for joining us.
Thank you for having me.